Hi, welcome to Senior Circuit. My name's Ashley Speliotis. I'm the Director of the Council on Aging here in Somerville, and we're joined today with Elaine Miller, the Regional Director of the SHINE program with Minuteman Senior Health. Thank you so much for being here.
Thank you, Ashley, for inviting me.
Yeah, it's a busy time of year for
Very
you
busy.
with open enrollment. I'm sure we'll get into that.
Yep.
But why don't you share with everyone a little bit about yourself and your role with Minuteman?
Well, I work at Minuteman Senior Services based in Burlington. I manage a regional benefits counseling program for all Medicare beneficiaries, and we do cover Somerville and Cambridge. Our service area includes Greater Burlington, Somerville, Cambridge, and we also serve people in the 495 North area out to Stowe, Mass. So Medicare benefits counseling is made up of, it's a statewide program. We're one of 13 regions. Minuteman Senior Services is also a home care organization. My role is really to manage state-certified SHINE counselors. They can be in-kind counselors that work at Somerville Senior Center. And we also have a number of volunteers that are all of the individuals involved in the program are state certified, meaning they've gone through a 40-hour training program. And I manage the program, and I really have a lot of fun with it. I really enjoy our volunteers, very dedicated people, and we all love what we do.
Yeah, absolutely. You just mentioned that we have 2 SHINE counselors in Somerville Council on Aging located there. There are social workers through the rest of the year, but in October, November, December, they are known as the SHINE counselors.
And they're wonderful.
That's right. And
Yes.
SHINE, usually they call, say, can we talk to the SHINE counselor or help with insurance coverage, but what exactly does SHINE stand for, and why was it created?
That's a really good question. SHINE's been around in the state of Massachusetts for more than 30 years. The acronym itself stands for Serving Health Insurance Needs of Everyone, which is very broad. I like to refer to the program as the Medicare Benefits Counseling Program because everybody knows what that is. Anybody on Medicare, regardless of age, can visit a SHINE counselor. They are based at all senior centers throughout the state. In your case, we have wonderful social workers, Molly and Natasha, to help people in Somerville. But yes, SHINE is a Medicare Benefits Counseling Program, and we do serve people on Medicare with disabilities, so younger than age 60. And then we serve people that are 65 and up that are enrolling in Medicare for the first time due to retirement, or they're on Medicare because they're retired and they want to search for other options to supplement their Medicare plan, because Medicare wasn't really ever designed to be 100% of your health care coverage.
Right.
So.
And that's sometimes, shocking for people that it doesn't cover 100% of your healthcare needs. So throughout the rest of the year, SHINE counselors are really helpful for that transition on to Medicare. And maybe explain a little bit of why that's important to meet with a SHINE counselor even before you're on Medicare.
It's a great idea to meet with a SHINE counselor locally. The service is no cost. You can get some very good impartial advice, and they will steer you in the right direction. We talk to many, many new retirees or people calendaring their retirement date that really don't know where to start with Medicare. It's a whole different system from their employer group health plan. They don't know how it works. There's Medicare A, which is hospital side, Medicare B, outpatient side, and then there are the gaps in Medicare because it only covers 80% of your medically necessary care, and there are deductibles and co-pays that can add up. So people need to start somewhere, and we see a lot of people that are planning retirement well in advance that sit down with a SHINE counselor and get direction. When do I enroll in Medicare? How do I enroll in Medicare? What does Medicare cover? What's Medicare A? What's Medicare B? And why do I need another plan? And how much is it all going to cost me in the end? We work with people's budgets. We work with their primary care and specialists. We can do a search based on medications, and we try to identify the best possible option for them to go along with their Medicare, whether it's a traditional Medigap supplement, which have been around for many, many years, or one of the Medicare Advantage plans that people hear about this time of year in particular. They're advertised very widely. There's a number of Medicare Advantage plans that all act like an HMO or a PPO, and they're also standalone Part D drug plans. So we kind of help people sort through all of that. And it is a maze, and we do a lot of education, and this is a great opportunity for us to really let people know what we do and how we do it and where we do it in the community, so that they can call on us year-round. We're available. We also help people navigate claims issues, billing issues, grievances. A Medicare Advantage plan may not pay the bill. We want to know why. We dig into that. Did they not have a referral? Was it on the consumer, or is it something that we can work with the insurance company to alleviate and get that person reimbursed for the care? So we also screen people all year for public benefits, public health benefits. Sure. And the nicest benefit the benefit that we love in the SHINE program really is Medicare Savings Program, and we screen people all year. So if you're an individual and you're earning $2,935, or you're a husband and wife or married couple earning $3,966, you're eligible for the Medicare Savings Program, and what that will do is let you keep the Medicare Part B premium of $185 in your Social Security check, and it covers all your deductibles and co-payments. Plus, it gives you extra help, so your Part D is covered. So it's a great federal insurance plan, and it's a one-page application. And no, here in Massachusetts, we're one of 11 states that doesn't count assets. So we don't even look at that. So SHINE loves to screen people for public benefits, including Mass Health Standard. We also screen for Frail Elder Waiver, which is under the Mass Health umbrella, and it's designed to help people stay in their home with a good amount of home care services, almost 24/7, personal care attendance. It helps people stay out of nursing home care.
That's wonderful. I mean, it sounds like SHINE does a lot the whole year through. But what I think you mentioned is that before people turn 65 or 67 or their retirement age, it's nice to meet with a SHINE counselor to get an idea of what Medicare looks like and what Medicare might look like for them. But then the whole year through and for many years to come, SHINE is there if you have changes to your income, your health benefits, your healthcare needs, medications. And I think that's what you see around this time of year, right, is open enrollment. So open enrollment, why don't you explain what that is, like bare bones, what is open enrollment? What makes it a special time of year?
It's a busy time of year for SHINE and for anybody that's on Medicare. Open enrollment happens every October 15th through December 7th, and it's that 7-week window of time that anybody on Medicare has an opportunity to shop for insurance and see what the best coverage is for them, the best plan, the best pricing, a plan that covers all of their medications, a plan that covers all of their primary care doctors. This year happens to be a very busy open enrollment period because there's been a number of changes that happened here in Massachusetts specifically. Blue Cross Blue Shield eliminated one of their Medicare Advantage plans, which was zero premium, and many of the doctors that are connected with Beth Israel Lahey Health, that's really driving a huge volume into the senior centers to get SHINE assistance so they can not only choose a new plan but choose a new PCP if they need to. Tufts also had some changes with one of their Medicare Advantage plans that are impacting those members, so people are shopping for a new plan. All of the plans across the board have raised their premiums slightly. Some of the Part D plans don't cover all of the medications they used to. So it's really a good time for people to kind of kick the tires, look at what their options are, use the Medicare Plan Finder, talk with a SHINE counselor, and see what's out there for them, and make sure that they have all of their covered services and benefits that they've relied on without any surprises. So
Exactly.
yeah.
It seems like the time of year where it might be two options to see a shine counselor. One, you've had some changes in your health, or you've been prescribed a medication that just isn't covered enough for you, and you can go to the shine counselor and say, well, what insurance plan does this better, would provide better coverage. But it's also a time when a person can go and say, what are those changes for
Yeah.
next year? What is my health insurance cost going to
Yes.
be for the year to come? Because we don't always know it, or we don't always read about it. Would you
right.
say that's true?
Every September, to prepare Medicare beneficiaries, the plans and the government send out an annual notice of coverage. And a lot of people don't read that. It comes in the mail. They just don't pay attention to it. So Shine is a good service in order to prevent any surprises in terms of your coverage. A lot of times physicians may prescribe a medication that's not available in a generic, and that can really bump up the pricing on your Part D plans. The medications are tiered. There are 6 different tiers, so it's good to look at that. Sometimes a physician may prescribe a name brand medication and there's a generic that would be lower cost that they can speak to their doctor about. Sometimes people are prescribed something because they're allergic to a medication or have an adverse reaction to it, and we can help them navigate a Medicare exception so that that drug can be covered, and they do that through their doctor's office. But really, it's a good time to be looking at the coverage and the summary of benefits. And even if you don't see a Shine counselor, it's a great time to just navigate the internet, go to Medicare.gov, look at the Medicare Plan Finder. You can pop in your zip code, pop in your medications, and it will call up the lowest price plan first. And you can also enter your PCP. So if you're at home, you don't feel like you need to visit a Shine counselor, and right now our appointments are jammed, you can do this navigating the internet, and it's a very easy site to work through. And the pricing is accurate, the medications are all there.
So people can go right to Medicare.gov, click on Plan Finder, and enter their medications in, and confirm to see if their drug plan or Part D plan is the best for them, or if it may be time to switch. I know it's always interesting to see what pharmacy you use and how that can affect the coverage as well.
The Plan Finder also allows you to pop in your pharmacies, and you can plug in up to 5 pharmacies locally based on your zip code. It will show you the preferred pharmacy, and that would be the lowest cost plan first. It will show you if pharmacies are out of network. It would also show you if the doctor's in network or out of network. In the Shine program, we always advise people before they make a change that they contact their primary care doctor and they verify that their medications are covered. It's just another step, and it really helps prevent any mistakes from happening. But if somebody does join a Medicare Advantage plan during this open enrollment period and they're not happy with that plan, they have a do-over in January. So we also help with that. They have a 3-month window where they can select a new Medicare Advantage plan. And throughout the year, if someone's condition changes, if their health dramatically changes, and they're in a Medicare Advantage plan that's not working for them, they can still see a Shine counselor, and we may be able to find ways that we can get them out of that plan and into a traditional Medigap supplement. The difference between the two is that Medigap supplements, you're in charge of your health care. You have no restrictions in terms of the network. There is no network. So you can go to any hospital, any doctor in any state, anytime. There is a premium for that. They're higher cost plans, but they work for people that do travel outside of the state often to see grandkids or, vacation in Florida. They like that freedom of of knowing that they can go to any doctor if they had a slip and fall or an emergency. So the difference between the Medicare Advantage is that they're restricted. There's a network. There's a network of providers, a network of hospitals. There's extra benefits that Medicare doesn't cover, like vision, dental, and hearing. the traditional Medigap supplements do start at $142 and go up from there to about $260. The Medicare Advantage plans offer those zero premiums, so we really look at everything because it's not a one-size-fits-all. So that's what Shine can do.
That's right. It sounds like it's very individual.
Yeah.
Because, so just for everybody at home, you know, traditional Medicare, you say, which is Part A, hospital coverage, Part B, doctor coverage, outpatient coverage, and then the supplement
C.
plan.
They call it C
Part
sometimes.
C for the Advantage plans, which is kind of everything all rolled into one.
Yep.
Maybe some lower upfront costs, some extra advantages, but maybe down the line it wouldn't work for you.
You can change insurance every year, and what I like to do, and I do love counseling people and giving them their options. I try to say to a healthy senior that's new to retirement, you know, how many meds do you take? If you don't take any meds, if you're in good health, if you're accustomed to having an HMO or a PPO, it's an easy transition to make. If you're an individual that has chronic illness, diabetes, type 2 diabetes, there's a number of underlying conditions associated with diabetes. You may see a cardiologist, you may see a neurologist, you may need PT, cardiac rehab. If you have a chronic illness and you are at the doctor frequently, or you have a number of specialists, it might make better sense for you to look at a traditional Medigap supplement, because all of those $25 copays add up. So we look at that. You may have better coverage, you have more freedom, you're not restricted by that network. Although with the Medicare Advantage plans, at least in Massachusetts, I find that the networks are very broad. They cover many, many hospitals in the area. So we are fortunate that in Massachusetts we have a great healthcare system.
Exactly.
Yeah.
And we're fortunate to have the Shine counselors to help make these decisions, because that's one of the major decisions when you're transitioning to Medicare, traditional Medicare or the Advantage plans. And then now during this open enrollment, and like you said, the advantage of the Shine counseling is that sometimes they can find some different pockets or exceptions of if things aren't working for you. And I know you mentioned a little while ago too that they can also screen if health insurance is too expensive for you. And what can they screen for?
So one of the goals in our program is to work with people that are low to moderate income, and we do screen people for Prescription Advantage, which is a Massachusetts prescription assistance program. We screen for Medicare Savings Program, which I mentioned previously. We screen people for Mass Health Community Standard and help them walk through that application, start to finish, and work with Mass Health as well. We screen people for the Frail Elder Waiver. We screen people for Senior Care Options, which is a dual eligible program for people on both Mass Health and Medicare that provides care management and wraparound services for people that are aging in place. So just a number of different programs out there. There are many, many options, and we really do love to work with people and find something that fits and find something that can be a cost savings for them if they're coping with high cost of food, high cost of rent. If we can put $185 in their pocket every month, that's great. They can apply that money to other expenses, and as we know, all of our costs are going up. So yes, that's a wonderful benefit of the Shine program. People may be at home, they don't know what they qualify for, and they're struggling, and they're on Medicare, and that's a good call to make to the Somerville Council on Aging.
Absolutely, because each, I mean, even you listing them all just now, there's varied in how you qualify and what would help with what, because some, you said, help with the actual prescriptions when you go to the pharmacy. Some help with the Part B copay for it, and just having the chance to sit down and talk with somebody sometimes goes a long way in seeing what somebody could qualify for.
Very private meetings. We are all HIPAA trained and take confidentiality of our consumers seriously, and so people should feel free to take advantage of the service if they need the help.
Yeah.
Again, we love saving people money especially as things become more challenging.
And they can screen people all year through for some of these programs. I think we talked a lot about why people should go see a Shine counselor. But once you have the appointment, is there any advice for people on how to prepare for an appointment?
It's going to be difficult to find an appointment right now, but we hope that our Somerville Senior Center can find room for people that are shopping during open enrollment. And what people should bring to a Shine appointment, really their Medicare card, which has their ID numbers, if they have a Mass Health card, if they have other insurance card. We ask questions like date of birth, and that's really all we need is what insurance are you on today, and a list of your medications with dosage.
So very easy, we'll say, to make an appointment with the Council on Aging. You can call us right at the Senior Center, and easy to prepare for it. And then they walk you through step by step. And we've been talking about the Council on Aging, of course, where we have Shine counselors trained through Minuteman, also social workers there by day. But the Shine program is really based on volunteers. Is that right? So what are your makeup of the Shine counselors, and how do you become one if you'd like to be one?
Most of our counselors are volunteers, and our social work staff at the Somerville Senior Center have the benefit of 2 great counselors that volunteer their time in both Cambridge and Somerville, so they can call on individuals for help when they get booked up, which is a great service to the staff. To become a Shine counselor, I look for people that are detail-oriented but also have empathy. Obviously, you need to have the ability to work with older adults, work with people that have disabilities, work with people that may have some cognitive loss, have patience and understanding, and meet people where they are, not rush through the process, and also detail. And the ability really to use technology, because we have a lot of apps that we do that help us do our work. So you have to be able to navigate. We ask for a commitment of 2 to 4 hours a week. Our counselors go through the 40-hour state certification, and each spring they're recertified, which is a lot easier to manage. Our individuals are placed at senior centers throughout our service area and throughout the state, and they contribute up to 4 to 5 hours. They add extra hours during open enrollment. They attend a training meeting once a month. It's a great group, a lot of camaraderie. We talk about cases, we problem solve. I'm really just looking for people that can work with older adults, be compassionate, non-judgmental, and really get a grasp of the details, because there's a lot of numbers in the program. So
that's right. But once you get trained and used to it, you're there, really helping to solve and share about insurance for everyone. Well, thank you very much for being here today and talking about Shine, especially during this year's open enrollment.
You're very welcome. Thanks for having me, Ashley.